Now, Health Matter, you dey watch on top your #1 family entertainment channel. Of course, I go agree to the fact that I like the timing where they be fix this particular program, because health na general matter, you understand? So it has be a time where everybody go dey house. That means say mama go dey house, papa go dey house, children sef they no go carry last on top the benefit of health wey we dey always carry come through on top your #1 family entertainment channel. And of course, the Saturday, the 11th, 10th day, between 10th and 11th, 10th, okay, thank you. The 10th day in the month of September, year 2022. Good morning, Lagos. Good morning, Nigeria. They call me the slimmest of them, but of course, once you see me, you're supposed to say the certified doctor. Do you understand? The one where God give. You do research, you read down. What's it day here now to make sure say on our life better health-wise. So, ladies and gentlemen, of course, if you guys are not too busy, join me as I welcome our own very own Dr. Barth on the show.
Thank you very much, slimmest of them all.
My doctor.
Always beaming out smiles.
I mean, what can
Good morning, viewers at home and around the world. We're happy to be back this morning on Health Matter. We'll be treating a very familiar topic that each and every one of us, I want to believe, must have heard of at one point in time in our lives. And of course, today's topic is hypertension, often known as the silent killer. Why is it called a silent killer? We'll know all of that as we go into the presentation proper. Okay, so we'll try and look at the definition of hypertension. We want to see the types of hypertension that affect humanity. And of course, we'll do an overview, okay, of what hypertension is all about, signs and symptoms, if any. And we'll talk about the presentation, the diagnosis, how the hypertension can be diagnosed. Okay, what is the latest about hypertension? You will agree with me that is a topic that is very concerning because of the high incidence or prevalence of increased rate of sudden death. We usually hear people dropping dead, people with no sign of sickness whatsoever, just dropping dead, and that will be it. And recently we saw a number of frightening videos that went viral of such occurrences. So people are beginning to get worried. What could be responsible? And that is why we are here today to talk about hypertension. Don't forget, September 29th is World Heart Day. Okay. Usually is the month that we talk about and raise awareness for cardiovascular diseases. So we are starting with hypertension. Now, what is hypertension? I will try and simplify the definition and all the things that we'll talk about today in a way that each and every one of us can understand, can take something home from today's presentation. Now, hypertension is a medical condition in which you have an abnormally elevated blood pressure. When our blood pressure gets elevated to unhealthy levels, we'll start talking about hypertension. But it's not all of that. It is not only when it is elevated, it needs to be elevated and sustained over a period of time. Okay, so you cannot just have a patient before you, seated before you, and you make a diagnosis of hypertension, except in some peculiar cases when the BP is very highly elevated. That can happen. Otherwise, you need to take the reading at least, some literature say at least a day apart, some say at 4 to 6 hours apart, to be able to have an idea. Okay, before now, what we know as a normal blood pressure is when you have a reading that is above 140 millimeters of mercury over 90. But before I get to the readings, let me talk about how these readings came about. We all know that the heart is like a generator in the human body. Okay, so the function it does is to pump blood that carry nutrients and oxygen to organs and tissues of the body. Okay, so if you make a fist, everybody who makes a fist, your heart is about the size of your clenched fist and is located on the left side of your thoracic cavity. So that is the position of your heart. Okay, good. It's not centrally located.
To go with time because this one is too small.
Okay, so that gives us an idea of the location of the heart in the human body. And what happens is that when the heart pumps blood, it rests for a while. So during that time that is pumping blood, that pressure that goes with it is called the systolic pressure. When the heart is at rest, when it's recoiling, in between beats, we'll talk about diastolic. usually the reading that you find below. Yes, we have it being shown on our screen at the moment. Usually the reading that you have below. Okay, so when you talk about systolic hypertension, we are referring to that force, the peak of that force that happens when the heart begins to pump blood. Okay, when it's relaxing, there is still some degree of pressure. It doesn't get to zero level. Okay, so that is called diastolic, and that is why we have two readings. Okay, before now, what we used to know is any reading above 140/90 is regarded as hypertension. But all of that have changed now. There are newer guidelines, okay, by American Heart Association. Now we have what we regard as normal BP as a BP that is less than 120/80.
Okay.
Okay. Now, what we know before now is that anything above 140/90. Okay, so listen to what I'm going to say now. Normal BP now has dropped to 120, anything in the neighborhood of less than 120 to 80. Okay, it's being shown on our screen now. Now, when you have elevated or pre-hypertension, you're talking about a BP of 120 to 129 on the systolic, and of course, less than 80 on the diastolic. But we start talking about stage 1 hypertension when you have a BP, the systolic between 130 to 139 millimeters of mercury and 80 to 89 millimeters of mercury. That's for the diastolic. So stage 2 hypertension now becomes what used to be normal, or what we used to take as normal. When you have a BP greater than 140 and also systolic greater than 140 and diastolic greater than 90, is now called stage 2 hypertension. Now, with this description, nearly half of all Americans are hypertensive, according to statistics. And WHO has made us to understand that an estimated 1.2 billion people globally are battling with this disease. Within the age range of 30 to 79 have this challenge. And about 46% of these people that have high blood pressure or hypertension, if you like, are not yet diagnosed. They don't know they have it.
They have it. So
46% is about nearly 600 million people globally have hypertension with no idea whatsoever that they have it. It should be about 588 million. 800,000 individuals have hypertension without having an idea that they have hypertension. And of course, within this time, it causes a lot of havoc. It does a lot of damage to the human system. I will give an analogy so that we can understand what it's all about. Now, when we talk about hypertension, we need to talk about the cardiac output, the blood that is pumped from the heart. Okay, the force of this blood that is pumped to the heart against the total peripheral resistance that usually comes from arteries. Now, when the heart pumps blood, this blood that the arteries, that the heart is pumping, we go through a set of pipes called arteries that will distribute it to every nook and cranny of the human body, the legs, the hands, and everything. So you can imagine some of us when we were much younger, if we are being driven in our parents' vehicle, oftentimes we want the glass to be down.
Yes.
Okay, so that we can enjoy some cool breeze. But you notice that when the speed of the car increases, the resistance of the air that will be coming your way oftentimes will make you unable to even open your mouth and talk very well.
Yes.
Now, this is the kind of thing that happens to the cells of the body, to the organs and tissues when the blood pressure is elevated. The force that is coming their way is destructive. It's so firm that gradually it begins to destroy the blood vessels. Over time, it will start affecting and can cause end organ damage. It can damage the kidneys. It can damage the arteries that are found within the eyes. When that happens, you will start having visual changes. Oftentimes, it could end in blindness. So these are some of the complications that can occur. When that pressure is too much and is getting to the vessels that are found in the brain, it could burst. And if it does burst, it gives rise to what we call stroke. And that is how people come down with CVD. Okay. So that we won't be thinking that it's that old man in your village
that is responsible.
That is responsible when it happens. So there is need for us to get familiar with our numbers. We need to know some of those things. Now, how does hypertension present? Oftentimes, it shows no symptoms. And that is why it is called asymptomatic. What are the major types? Two major types: primary hypertension and, of course, the secondary hypertension. The primary hypertension is responsible for 90 to 95 cases of all hypertension that exist in humanity. Out Whereas the secondary hypertension has about 10% prevalence globally. Now, primary hypertension, the cause is usually not known. Okay, but there are some risk factors that we usually talk about that are associated with genetics as well as lifestyles. Okay, so we will now need to look at the risk factors that are associated with type 1 hypertension, which I said is essential, or primary hypertension, and the cause is largely unknown. Some of those risk factors, I will categorize them into two: modifiable risk factors as well as non-modifiable risk factors. For the modifiable risk factors, these are things you do not have a right. You can actually not make changes along those lines. One of them is the fact that you're increasing with age. So we can't change our age. So it's a factor. Yes. So hypertension could come with advancement in age. Number two, sex. The fact that I'm a man and Slimity is a woman, we can change that. Okay. The other risk factors that are non-modifiable that could actually pose a challenge is obesity. When you allow yourself to become overweight, graduate to obesity, class 1, class 2, class 3, some other times we will dwell on obesity. Okay, so that's a major risk factor. The fact that you smoke, you need to stop. Cessation of smoke is something you must take as a matter of importance. If you're still smoking, you're killing yourself gradually. Okay, harmful use of alcohol. Okay, I use the word harmful use of alcohol because some alcohol could, could be permissible, can actually be helpful. Okay, and lack of exercise, sedentary lifestyle. Okay, because of the urbanization, a whole lot are changing. Hypertension is on the increase. A lot of what guests are driven to our offices, get to the offices, we barely walk around. We sit on the seat and roll from one side of the table to the other. We don't exercise. Physical inactivity is a risk factor for primary hypertension. Okay, so these are some of the things that can serve as risk factors for primary hypertension. What about the secondary hypertension? Oftentimes, the secondary hypertension will have an underlying cause. And of course, if you treat this underlying cause, the hypertension will go. Okay, so you can hear some people saying, I had hypertension over time, I didn't have any more. Suffice also to point out that hypertension is not curable. But for people who have secondary hypertension with identifiable or an underlying risk factor that could be treated, such people could get well over a period of time. And what are these causes of secondary hypertension? A whole lot of them have to do with the kidney. Okay, so that's why you normally hear us talk about kidney can cause challenges with the kidney. Problems with the kidneys can cause hypertension, and hypertension can also affect the kidney, vice versa. Okay, some of the things, I won't bore you with the medical terms, but I will just mention them in passing. Okay, renal artery stenosis can give you hypertension. Chronic kidney disease can give you hypertension. Nephritic syndrome can give you hypertension. These are some of the known causes that could be pictured. What about females? People who use contraceptives, can actually be predisposed to hypertension. Preeclampsia can predispose one to hypertension for females who are pregnant. Okay, these are hypertension that can occur in pregnancy. We'll still talk about pregnancy-induced hypertension. Okay, but preeclampsia is a risk factor for secondary hypertension. We are looking at the cardiac output, the force of the cardiac output, the pumping of the blood that is coming from the heart against the arteries, the walls of the arteries. Okay, medically we call them peripheral artery resistance. Okay, so what happens over time is that because of the increase in pressure, the arteries through which this blood passes, okay, over time there will be deposition of plaques. That will harden the blood vessels, the arteries, in such a way that the lumen will start reducing. And the heart will have to increase its pressure. And of course, the organs of the body that we used to getting normal flow of blood will start getting deprived of blood. They will start getting deprived of blood. In some cases, if it has to do with the coronary artery, the arteries that supply the heart, if a particular portion is blocked entirely, that person will develop acute myocardial infarction, which we'll call heart attack. Okay. Now, in some cases too, if the pressure is so high and it bursts within the brain, the person will come down as stroke. So you can see centrally, hypertension is responsible for all of these cardiovascular events. Okay, so, and the irony of it all is that this thing is happening in our system without our knowledge, without we knowing.
I mean, doctor, I'm sorry, sir, because from growing up, I know, say, there was a time I knew my dad was treating, and that day I know, say, it can actually be managed, because over 20 years and still counting, he's been managing it. And then I've been thinking, say, hypertension about age. But now these days, you hear people in their 30s, you hear people, close to 30s telling you they get hypertension. So I don't know. And you said once you don't get to a particular, you get to have it. But now in their 30s, what's actually responsible for that?
Thank you very much for that very important question. Now, we have early onset diabetes or diabetes in young adults. Okay, so part of the things that are responsible is genetic.
Okay.
It runs in families. You can't take that away. Okay, so, and of course, lifestyle. Okay, so we need to do a whole lot in trying to do lifestyle modification. We have
Stella
from Ebonyi. Good morning, Stella.
I'm calling from Ebonyi State in respect of the health information. I just tuned in now and I'm interested in the information. So I have a question to ask the doctor.
Yes, go ahead.
My question is, I normally check my BP. At times, they will tell me that the BP is 120/80. At times, 120/70, which is normal. But when I come home, at times I will be having palpitation. And the palpitation I mean is I'll be hearing my heartbeat. So I want to know what I will do.
Thank you very much. Thank you very much. Thank you very much. She sounded very medical. Are you a nurse?
I'm not a nurse, but I'm a health worker. I work in
that looks more like it. That looks more like when she used the word palpitation. I needed to throw more questions to her to actually find out. She appropriately applied it. Thank you very much for those key questions. Now, let me say this. The BP you presented to us are normal. Okay, the normal BP by all standards.
As in 120/70,
120/70, 120/80, anything less than 120/80, you're good to go. Okay. Now, but there are other things that can cause palpitations in the human body. A whole lot of other things can cause palpitation. One of the things that can cause palpitation more in a female is people who have challenges with thyroid. It could be thyrotoxicosis. Okay, it could be any thyroid pathology usually will present with that. Okay, increased heartbeat. Okay, when you are unduly aware of your heartbeat. Okay, so basically what I'm saying is that we need to look beyond hypertension. Okay, for someone like you, I will advise that you should go and do a thyroid function test. Okay, that usually
thyroid function test.
Yes, a set of tests that can actually give you an idea of what is responsible for that. Thank you very much. You can see your doctor for further evaluation, but you need also to evaluate. Evaluation should be done along that line. It should go beyond, the look should be beyond hypertension. Because from the readings you presented to us, your BP appears to be within normal range.
Okay, thank you very much.
Yeah, thank you very much for calling in.
Do you normally have it every Saturday?
Yes, every Saturday from 8:30 to 9:30
to see the ones we have done over the years.
Yes, so
let me also drop this. Health Matta is already 5 years.
So
we'll be doing our 5th year anniversary next week.
Doctor, that's so unfair. Thank you very much, Stella. But anyways, like you said, for those that missed it, I mean, 5 years, glory to God. I didn't know we have even come this far. So we've had so many amazing topics over the years, and the best you can do for yourself, if indeed you love your health, and to go back and watch those videos. All of them, all of the past videos of Dr. Barth on Health Matta Day on our YouTube channel. So just search for us on YouTube.
Thank you very much.
At Swap TV channel. Doctor,
yes,
wow.
That's virtually.
I should have promoted him. I'm going to get a small nurse now.
That's and of course, you and our chief Olododo himself. There's virtually no topic that we have not treated. Touched. Seriously. With the help of healthcare professionals that we usually invite to come and join us and do justice to the topic from time to time.
Can say that again.
Yeah, thank you very much.
Yes,
now, let's go back to signs and symptoms of hypertension. We have talked about that in most cases, there may not be any symptoms.
Yes, sir.
And of course, that is why it could go unhidden from people, unnoticed, over a period of time. But in some cases, you could have symptoms.
Okay.
And what are these symptoms that one can have? You can have headache, usually a throbbing headache that occurs early hours of the morning. Okay? You can have blurring of vision. In some cases, one can have palpitations, just like Stella pointed out. Okay? You can have chest pains. You can have easy fatigability, weakness when you have severe hypertension. Okay? Now that I've mentioned severe hypertension, severe hypertension is actually when you have a hypertension of over 180 millimeters of mercury, 180 over 120.
Wow.
And that we usually refer to as hypertensive emergency or hypertensive urgency, depending on whether the end organs are beginning to get affected. Okay, so if there are signs of end organ damage, we'll be talking about hypertensive emergency when it elevates to that high level. But if there are no signs of end organ damage, we'll be talking about hypertensive urgency. Okay, so that can happen. Okay, in such cases, one can have a number of symptoms that could actually make you know that something is abnormal in your system. You can be confused.
Wow.
Okay, you could have an abnormal heartbeat, arrhythmias. Okay, you can be unsettled. You can become nervous. Oftentimes, when people have those challenges, they usually race to the hospital.
Jubril.
Hello.
Hello, Mr. Jubril. Good morning.
Good morning, ma.
We know the hear Amo. I don't know. Can't hear you.
Can you speak louder?
Can you speak louder? Yes.
Good morning, ma.
Good morning, sir. I think it's better, but you can still do better. I don't know if it's from us or from me. Are you using an hands-free?
Eh?
You dey use hands-free. You get Bluetooth for your ear. We know they hear you well.
Okay, I don't have one. Oh.
Okay, better. We can hear you now. Please go on.
Okay. You see, sometimes last week, can you hear me?
Yes, go ahead.
Okay. Last week, I was attacked with malaria.
You were attacked by malaria?
With malaria. So
okay.
when I went to hospital, doctor checked my BP. When he checked the BP, he told me that I. So and after he has given me some drugs, when I come back home, I started using the drugs. My left eye vision was trying to give me problem. I cannot see very well. So I go back to him again, check again. He said it's still high, and he changed the drug for me. So I don't know.
We can't hear you, Mr. Jubril. We honestly cannot hear you. The only thing I hear is you were attacked, you went to the doctor.
Yes.
But the main point, we never hear him. So I don't know if you call us back. And this time around, go place where you know say better network day. Thank you.
Thank you very much. Back. It's a pity we couldn't take that.
Couldn't hear him. I hope he calls back. Definitely should call back. Okay, doctor, you were saying something. So.
I was talking about the signs and symptoms. And of course, visual changes may start occurring over a period of time. Okay? And
Does
in some cases,
blindness?
Yes, it can cause blindness. It can cause blindness. So what I want to say is that when you notice some of these symptoms, please do not just wave them aside, particularly chest pain. Anytime you're having chest pain.
Now, doctor, I'm sorry.
Yes.
Is there a particular place to be worried about when it comes to the chest? Like, since our hearts, they our
Yes.
left. Should we
Yes.
be worried about that part?
No, no. When you have chest pain, usually it may be difficult to actually identify the side.
Okay.
Okay, but chest pain, we are talking about pains in this region, thoracic region.
Okay, sir.
I do know that oftentimes people regard pains that come from, okay, we have another caller.
Evelyn! Evelyn! Evelyn, good morning.
I like that.
Good morning.
Yeah.
How you doing?
I'm fine.
All right, please go on. Good to have you on the show.
Yeah. Oh, please. I want to. Good morning.
Good morning, my sister.
Yeah, good morning.
Yeah.
I'm fine.
Morning.
Please, I want to ask a question concerning this hypertension. So, if you always have your hypertension like 140/90 or 145/90 at age 36, is it normal?
No, it's not normal. Such a person is already on stage 2.
Wow.
From our new guideline definition, the person is already on stage 2 hypertension. So the person should go and see his or her doctor. And oftentimes, what you need to do, because let me also add this to what you have just said now. People run away from coming to see us when they have issues with hypertension. They think when you come, we'll put you on drugs for hypertension. And there's this notion that once you start that drugs, you can never stop. That is better for you not to start at all. It's wrong. It's not true. Depending on what is causing your hypertension.
Okay.
No two hypertension. If you have 3 or 4 people having hypertension, they may not be of the same age.
Okay.
For all you care, the hypertension could be of different causes in this set of individuals that are before you. Okay, so yours may be different from the other person's own.
Yeah.
Some even go as far as sharing drugs.
Wow.
Okay, with relations. Once somebody says my heart is beating fast, if the mother is on antihypertensive drug, you say, okay, I have one drug.
You can say that again.
You can take this one. Okay, so there are some drugs that will give in respect of what we're having.
Okay. Adeloju.
Trinity, I greet you.
Good morning. This is the first time you are calling on Health Matta.
Exactly.
Good
Nice
morning.
one. Good morning. Please go on.
Good morning, Dr. Barth.
Good morning, my brother. Good to see you.
Good to hear you this morning, sir.
Yes, I want to see plenty of you. No, be only on top 5. Call on top health too. We are here.
Yes,
Thank you.
Yes, sir. So, please, I want to ask about the health condition of somebody very dear to me.
Okay.
The person just recently discovered she has sugar issue, diabetes.
Yes.
Yeah. So I really don't know the stage. I don't know if there are stages for diabetes. So I just want to ask those things that she needs to do to stem the effects.
Thank you very much. Diabetes is like hypertension is regarded as a chronic illness. Okay. Sometimes too, it could be a risk factor for even hypertension. And people who have both of them are predisposed to having more complications than somebody who does not have. Okay, but we'll come to that. But what you should advise your friend to do, he or she needs to get to the hospital to see the doctor. A diagnosis will have to be made. An evaluation, the person needs to be medically evaluated. They may need to run some set of tests to actually find out the type of diabetes he or she has. Because just like you have types in hypertension, you also have types in diabetes. Okay, so he or she needs to get to a hospital. Thank you very much for calling in.
Thanks so much.
Yeah, thank you.
All right, now.
So we're talking about fathers trying to give drugs to relations around them.
Yeah, let's just finish, then we'll go for the break.
Yes.
Thank you.
Okay, so in some cases, you may be given a drug that can slow the heart. And your heart rate, normal heart rate, heartbeat, is usually between 60 and 100. If it's somebody that is having a heart rate of 58, 40, and you give the person a drug that can slow the heartbeat, Maybe the drug that was given to the father because he was having tachycardia, elevated heartbeat. Okay, now you now give it to a son or a daughter because the person has high blood pressure. The person can actually slump and die.
Wow.
Just because you have given a medication that person shouldn't have.
Yes.
Okay, so we need to be careful about this. What is given to you is tailored to what the doctor, the picture the doctors are getting from your health records or your numbers.
That was a very key information.
Yeah, thank you very much.
But the one I would like ask doctor, because of the time now, how all of these contraceptives, other drugs, salt and co, how do they, I don't know, what's their relationship with hypertension?
Thank you very much. When we're talking about types of hypertension, we said that essential hypertension, primary hypertension, that's essential hypertension. That in 90% of cases, the cause may not be known. In medicine, we'll call it unknown etiology. Okay? So, but we know 10% of causes in secondary hypertension. And one of the causes appears to be what she has mentioned. The prolonged use of, we have Stella from Ebonyi.
Hello, Stella. Thanks for calling again, though.
Okay, please.
Yeah, thank you very much.
I have a question, please.
Yes, go ahead.
Sometime last 2 years, I was pregnant.
Okay.
So I lost the pregnancy at the 3 months and 2 weeks.
Oh.
Okay.
So when I was discharged from the hospital, after 2 weeks, I started urinating frequently. So I have to go back to the hospital. They run a series of tests on me. So they now said that my sugar was very, very high. So I was admitted for 3 days. On the 3rd day, I was discharged. So they told me that I should come back for checkup at least once in a month. So they referred me to all those dietitians. So those dietitians, they counseled me and told me the do's and don'ts. I should enroll in exercise. They told me how I will be eating. So I followed their instruction. So when I came back home, I went to the pharmacy. I bought the AccuCheck machine. So I keep on checking myself. So since last year till now, I normally check my sugar. So at times I will get 87. At times I will get 90. Like this morning, I checked this morning, it was 99. So my question now is, am I a diabetic, or is it because of the pregnancy that makes me to have that sugar? That's my question, please, so that you put me through. I'll know.
Thank you very much for that very wonderful question. You've given us the answer already. Thank you very much. Thank you very much. Very good one from there. Now, just like she mentioned, okay, somebody who hitherto had no hypertension, I'm talking about pregnant women now, hitherto had no hypertension, hitherto had no diabetes, can actually become diabetic with the pregnancy, can become hypertensive with the pregnancy. So we have what we refer to as pregnancy-induced hypertension. This is different from somebody who has always been a known hypertensive patient before the person became pregnant. Okay? So we have pregnancy-induced hypertension. That's what the preeclampsia and the eclampsia we saw in some of those videos. Okay? Good. Now, coming back to the case she presented, there's also what we refer to as gestational diabetes. Gestation has to do with pregnancy. Somebody who was not previously diabetic but became pregnant, and of course she showed up. Okay, but usually these things show up at a certain time. For pregnancy-induced hypertension, it usually shows up at about 20 weeks of pregnancy. Okay, so it shows up after a particular time, and of course there are management, there are things that can be done to manage them. In her own case, because she lost the pregnancy, the baby was no longer there. And over time, it resolves on her own or on its own. Okay, but in some cases, 10% of cases may not resolve. That is why preeclampsia is one of the secondary causes of hypertension. In 10% of people that it was brought by as a result of pregnancy, it continues like that the rest of their life.
Wow.
It doesn't get resolved.
So now she has to manage it.
No, she's not diabetic.
Okay, she's not diabetic.
What she had was gestational DM, which has resolved. Now she doesn't need to do anything. The exercise she embarked upon actually helped her. And that also takes me to my
But
take.
you didn't finish the question. My question.
Which one?
Talking the drugs.
Okay, now the drugs. Prolonged use of some drugs can actually predispose one to hypertension, but the type of hypertension is secondary hypertension. A group of drugs called non-steroidal anti-inflammatory drugs, NSAIDs. Okay, so they can do that.
Okay.
Lifestyle modification.
Okay.
One takeaway I want you to have from this is diet. You need to avoid high salt diet as much as possible. If you can do that, you have helped yourself greatly. You also need to avoid sedentary lifestyle. Exercise is very key. Important. You must exercise at least 150 minutes per week.
Wow.
Okay, 5 times weekly of at least nothing less than 30 minutes. If you can do this, some of these interventions, lifestyle interventions or modification, can actually help you to come over these things that we're talking about. We'll be continuing from where we stopped
next week on our 5th year anniversary. So you guys don't want to miss
this. So please go nowhere.
Go nowhere next week. Oh, we can take a break now. We love you guys. Thank you so much for joining Dr. Barth and I today. Let's do it again next week, Saturday.
I like that.
Of course, 8:30 to 9:30, where they talk about the same topic, the silent killer, hypertension. But right now, we are buying out so that other shows will continue on top of the channel. We love you guys. Have an amazing weekend.